Anxiety and panic attacks are both intense experiences that involve feelings of fear, worry, or discomfort, but there are some key differences between the two. Anxiety is a persistent and excessive worry or fear about everyday situations. It often involves anticipation of future threats or negative outcomes, and it may be triggered by specific stressors or perceived dangers. Symptoms of anxiety can include restlessness, irritability, muscle tension, difficulty concentrating, sleep disturbances, and a heightened sense of alertness. Anxiety symptoms typically last longer than those of a panic attack and may fluctuate in intensity over time. Anxiety can be generalized, affecting various aspects of life, or it can be specific to certain situations or triggers, for example, social anxiety or phobias. Panic attacks are sudden and intense episodes of fear or discomfort that peak within minutes and often occur unexpectedly. They are characterized by a rapid onset of intense physical sensations, such as a pounding heart or sweating, trembling, shortness of breath, chest pain, dizziness, or feelings of unreality. Panic attacks can be accompanied by overwhelming feelings of dread, a fear of losing control, or a fear of dying. Unlike anxiety, panic attacks typically subside relatively quickly, usually within a few minutes to half an hour. Panic attacks may occur in response to specific triggers or situations, but they can also occur unexpectedly without an obvious cause. In summary, anxiety involves persistent worry or fear about the future events of situations, while panic attacks are sudden, intense episodes of fear or discomfort that peak quickly often occur unexpectedly. While both anxiety and panic attacks can be distressing and disruptive, understanding the difference between them can help with accurate diagnosis and appropriate treatment. Recognizing whether someone is experiencing an anxiety attack or a panic attack can be challenging, as both can involve similar symptoms of intense fear or discomfort. However, there are some differences in the duration, intensity, and triggers of these episodes. Here are some key factors to consider when distinguishing between anxiety attacks and panic attacks. Anxiety attack. Gradual onset. Anxiety attacks have more of a gradual onset, with symptoms building up over time in response to stressors or triggers. Duration. Symptoms of anxiety attacks typically last longer than those of panic attacks and may persist for hours or even days. Triggered response. Anxiety attacks may be triggered by specific stressors, situations, or thoughts to provoke feelings of worry, fear, tension. Common symptoms of an anxiety attack include excessive worry or apprehension, muscle tension or soreness, restlessness or feeling on edge, difficulty concentrating, fatigue, irritability, and sleep disturbances. Panic attacks, on the other hand, are sudden onsets. Panic attacks often have a sudden and unexpected onset, with symptoms reaching peak intensity within minutes. Short duration. Symptoms of a panic attack typically last for a relatively short duration, usually peaking within 10 to 20 minutes, before gradually subsiding. No clear trigger. Panic attacks may occur unexpectedly without an obvious trigger or external stressor. Although they can also be triggered by specific situations or phobias, panic attacks are characterized by intense physical sensations, such as a rapid heart rate or palpitations, shortness of breath or hyperventilation, sweating, trembling, chest pains, or discomfort, nausea, abdominal distress, feelings of choking or suffocation, and a fear of losing control or dying. Individuals may experience variations in the presentation of anxiety and panic attacks, and some symptoms may overlap between the two. Additionally, some people may have both anxiety and panic disorder, and may experience both types of attacks at different times. If you suspect that someone is experiencing an anxiety or panic attack, it's important to offer support, reassurance, and assistance in seeking appropriate medical or mental health care if needed. Managing anxiety attacks and panic attacks involve similar strategies for coping with intense feelings of fear or discomfort. but there are some differences in approach due to the distinct characteristics of each type of episode. When managing anxiety attacks, you should pay attention to the situations, thoughts, or stressors that trigger your anxiety attacks. Understanding your triggers can help you anticipate and prepare for potential episodes. Engage in relaxation techniques such as deep breathing, progressive muscle relaxation, meditation, or mindfulness to help calm your mind and body during your anxiety attack. Use cognitive behavioral techniques to challenge and reframe negative or catastrophic thoughts that contribute to anxiety. Replace irrational thoughts with more balanced and realistic perspectives. Establishing a regular daily routine can provide structure and stability, which can help reduce feelings of uncertainty and anxiety. Stick to consistent meal, sleep, and activity schedules to promote overall well-being. Break tasks or goals into smaller, manageable steps and set realistic expectations for yourself. Celebrate your achievements, no matter how small they are, and be gentle with yourself during moments of difficulty. Reach out to support, friends, family members, or mental health professionals for encouragement and guidance. Talking to others about your experiences can provide validation, perspective, and emotional support. Minimize exposure to stressors, situations, or triggers whenever possible. Set boundaries and delegate tasks. And practice assertiveness to protect your mental and emotional well-being. When managing panic attacks, you should use grounding techniques such as focusing on your breath, naming objects in the environment, or using sensory stimuli, for example, touching a textured object, to help anchor yourself during a panic attack. Practice relaxation exercises such as diaphragmatic breathing, progressive muscle relaxation, or guided imagery to help calm your body's physiological response to panic. Distract yourself from overwhelming panic symptoms by engaging in activities that capture your attention and focus, such as listening to music, counting backwards, or reciting a calming mantra. Develop a safety plan for managing panic attacks, including strategies for seeking support from trusted individuals, accessing professional help if needed, and engaging in self-care practices. Acknowledge and accept the physical sensations of panic without judgment or resistance. Remind yourself that these sensations are temporary and will pass, and focus on calming and soothing yourself in the moment. Cultivate mindfulness skills and increase present moment awareness and acceptance of your experiences, including the sensations, thoughts, emotions associated with panic attacks. If panic attacks are significantly impacting your daily life or functioning, consider seeking help from a mental health professional. Therapy, medication, or other treatment modalities may be beneficial in managing panic disorder or reducing the frequency of severity of panic attacks. Remember that managing anxiety attacks and panic attacks is a process that may require experimentation and persistence. It's important to find strategies that work best for you and to seek professional support if it's needed. With time, practice, and support, you can develop effective coping skills for managing both anxiety and panic attacks.